We've covered symptoms, we've talked about how AFib is diagnosed, but what about risk factors? Who needs to be mindful of this?
Well, you pose a very important question, Lindsay. There are things one can do to minimize the risk of developing atrial fib. Risk factors for atrial fib are diverse. Some of them are what I call intrinsic to the patient, that is gender, older age, and genetic predisposition. These are not factors that can be treated or changed or prevented. While you can change your wearable genes, you unfortunately can't change your genetic makeup.
If only.
If only, right. And alas, while many have searched for the fountain of youth, none have yet found it.
That would be nice, wouldn't it? Well, what about what we can change?
The much more critical point for the patients, right? There are lifestyle factors that can be reversible or even avoided. And these would include things such as obesity, drinking too much alcohol, and smoking. There are published data showing a beneficial effect of significant weight loss. But unfortunately, one has to lose approximately 10% of their weight and keep it off for at least a year to derive most of the benefit here. And frankly, that's difficult for a lot of folks, and especially for people who are trying to do it on their own and they don't have a dietitian or some kind of weight loss program. Regardless, in my opinion, it is best to stay as trim as possible. And while some advocate total abstinence of alcohol, and I understand why, based on research that states it can increase your risk of AFib, I'm more of a practical guy, because when I talk to patients and tell them you can't have another drink, it's basically shutdown time. So for me, I'm more of a proponent of moderation in your drinking habits. I've learned that it's just hard for people who really enjoy a drink once or twice a week to totally abstain, and they basically won't do it. Now, on the brighter side, caffeine has yet to be shown to worsen your chances of AFib, so have a good drink of coffee.
We can appreciate that. Are there any medical conditions that play a role here?
Yeah, and that is really critical, right? Because these are conditions that need to be thought of, prevented, or certainly treated as early as possible. Hypertension is one of the most common problems seen in patients with atrial fib, and it needs to be treated early on. Other conditions are diabetes, heart failure, coronary artery disease, valvular disease of the heart, and increased thyroid called hyperthyroidism, and even chronic obstructive pulmonary disease. Something that often goes undiagnosed is a condition called obstructive sleep apnea. You've probably heard of people snoring too much at night, or somebody telling you, my spouse stops breathing. Well, those are common signs of obstructive sleep apnea. And in my own experience, it doesn't cause AFib in and of itself, but it can certainly make it worse, and it's appropriate that it get treated. Lindsay, there's another issue out there that still requires more research, but I've seen this in some of my own patients. Even though they don't have atrial fibrillation yet, there are some people who have just almost thousands of these extra beats in the top chamber, and there are some data suggesting they are more prone to AFib, but more data, I think, are needed before we have a conclusion to that.
Okay, well, now that we know what to look for, it's time to discuss therapy and treatment options.